Hello, dear friends. I'm Dr. Seema Gupta, an Ayurveda doctor. Friends, in today's video, let's discuss a quite common problem of nowadays, and that can cause a lot of panics if occur at any age group, mostly in youngsters. That is precordial cat syndrome. It's a sharp stabbing chest pain that we feel sometimes. Friends, what is precordial chest pain? It's a sharp stabbing sensation sometimes felt in the chest that occurs suddenly, most confused or correlated with some heart disease like angina pectoris or heart attack. Friends, this condition is called precordial cat syndrome or PCS as the pain occurs in front of the heart. Friends, in my daily routine, I also come through such type of patients and mainly youngsters who get afraid of some heart disease correlating it with that as they Google too much. Friends, searching Google is a good thing to keep you updated, but sometimes it may be misleading if your knowledge about something is not complete. So let's today know this disease in detail. So what is the difference between precordial cat syndrome and angina pectoris? Friends, the amazing news is that like a heart attack or angina, it is not dangerous or life threatening. Like in a heart attack, this pain does not radiate or spread to other regions of the human body, and also precordial cat syndrome will not cause different symptoms like drenching or nausea such as like in a heart attack or angina. Sometimes the pain can also be intermingled with gastric upset or acidity pain. So now let's discuss some features of precordial cat syndrome. Friends, in this pain is localized to a place to the front of the chest, usually no larger than one or two fingertips broad. Breathing can make the pain more extreme. A few people discover that shallow breaths might help to make symptoms dull. Other people state that one deep inhalation may evoke a popping feeling that may help to relieve the symptoms. Friends, precordial cat syndrome disappears just as quickly and unexpectedly as it appears, with time sessions usually lasting between 30 seconds to 3 minutes. It can be very uncomfortable. The condition may aggravate due to the emotional panic of the victim by confusing it with a heart attack. There are no other symptoms and no lasting signs. However, although it's very rarely dangerous and goes out of its own accord, however, it can trigger anxiety, and repeated shallow breathing can cause an individual to feel dizzy and empty headed. The feeling, also referred to as a taxider's twitch, might wrongly be mistaken for a heart attack, but it's in actually a very common condition that will happen during adolescence and early adulthood. In very rare cases, it has also been reported in younger children of age 6 and in older adults. So friends, now let's know the regions of precordial cat syndrome or chest pain. So, what can be the exact cause of pain? The truth is that we don't know exactly what triggers this stabbing and annoying pain, but many experts believe that the pain is a result of the irritation or pinching of nerves at the chest or thoracic cavity's internal lining, that is the pleura. It's not, however, due to the injury to the lungs or heart. It Although it's an ultimately benign condition, there should not be any underlying heart disease as ruled out by some professionals. Friends, now the treatment of precordial cat syndrome. Although there is not a guaranteed cure or a remedy of this problem, however, there are particular scenarios which may prompt an attack and those may be avoided. Friends, PCS generally happens at rest, never while sleeping, and frequently when the individual changes their posture suddenly. Hence, the possibility of an attack of precordial cat syndrome might be decreased to some extent by setting up straight and changing the postures with caution. Otherwise, also, it should be a habit to sit by keeping your backbone straight always. As mentioned earlier, it is mostly the problem of adolescents and young adulthood. The attacks become less frequent as we grow up and stops normally up to mid 20s of our age. So, dear youth, no more panic now. If you sometimes experience this type of sharp stabbing, sudden pain in your chest, lasting for a few seconds, just take a chill pill, improve your posture, and get relieved. If the intensity of pain is intolerable or remaining for a long time or occurring at short intervals, then there may need to consult a physician. So, friends, this was all about precordial chest pain and its difference with angina pectoris or heart disease. I hope you will like this information. Like and share the video and subscribe to channel. See you in the next video. Till then, bye.